Hi everyone, welcome to Imaging Study. Today we are going to see a case of pregnancy with uterine fibroid. A young married female patient came with amenorrhea for 4 months and lower abdominal pain. Let's see what we get on ultrasound. Here's the longitudinal section of the uterus showing the fetus is compressed by a heterogeneous mass at the anterior myometrium, causing compression over the gestational sac and its contents. The heterogeneous ecotexture of this fibroid suggests degenerative process within the lesion. So here's the picture of the fibroid arising from the anterior myometrium, causing compression over the gestational sac and also causing irregularity of the perimetrium. This fibroid is causing compression over the gestational sac. So will the fetus survive this compression? The time will say more. Here's the picture of the placenta also getting compressed by the fibroid. Again, the fibroid causing compression over the placenta and the fetus. Again, the picture of the fibroid with its compressing activity. So in summary, a heterogeneously hypoechoic oval area is noted at the anterior myometrium of the lower uterine body, causing compression over the gestational sac and its contents. Now the take-home message. A fibroid may either decrease or increase in size with time during pregnancy. Measurement of fibroid should be done carefully so that the clinician can assess the prognosis of the fetus due to fibroid. Thank you for watching. Subscribe to our YouTube channel for more videos. See you on the next one. Have a nice day.